What if the solution to Africa's health crisis already exists somewhere on Earth, working perfectly, and we are simply not paying attention? It does. And on day 16 of documenting my rise as a global health and wealth architect, I want to take you on a comparative journey across the world's healthiest nations, not to make us feel behind, but to give us a blueprint for what is possible when health is treated as the architecture of a civilization, not an afterthought. The healthiest countries on Earth, what they share. When researchers study the countries with the highest life expectancy, lowest maternal mortality, lowest child death rates, and strongest primary care systems, a pattern emerges that is impossible to ignore. Japan, Iceland, Singapore, Switzerland, Norway, Spain, South Korea. These countries are geographically, culturally, and economically very different from each other. But they share 5 non-negotiable foundations that the rest of the world, including Africa and Brazil, has consistently underinvested in. Foundation 1. Universal primary care. Every single one of the world's healthiest nations has a strong, accessible, well-funded primary care system. Not just hospitals for emergencies. A family doctor or primary care physician for every family, consistently, continuously, across decades. This is the foundation that catches disease early, manages chronic conditions before they become crises, and builds the trust between patient and system that makes everything else work. Foundation 2. Prevention over cure. The world's healthiest countries spend significantly on keeping people well, not just treating them when they're sick. Screening programs, vaccination coverage, nutrition education, mental health investment. The economics are simple. Prevention costs less and saves more lives than any cure ever developed. Foundation 3. Health equity as policy. In the world's healthiest nations, health outcomes do not vary dramatically by postcode, race, or income level. Health equity is not an aspiration, it is a policy commitment backed by funding and accountability. Foundation 4. Long-term investment. These countries have treated health as infrastructure for generations, not as a budget line to be cut when the economy tightens. Health investment compounds. A healthy population builds a stronger economy, which funds better health, which builds a stronger economy. This virtuous cycle is the single greatest economic discovery in the history of public policy. Foundation 5. Trust in the system. The world's healthiest populations actually use their health systems because they trust them. Trust is built through consistency, quality, accessibility, and respect. It cannot be manufactured, it must be earned, over decades. The lessons Africa must take seriously. Now let me speak directly to the African context, because this is where my heart is anchored even as I build in Brazil. Africa has 17% of the world's population. It carries 25% of the global disease burden, and receives less than 1% of global health expenditure. That disparity alone tells the story of a continent that has been left out of the global health architecture conversation for too long. But beyond the funding gap, there are structural lessons from the world's healthiest nations that Africa can adopt without waiting for more international aid. The primary care lesson. Africa builds hospitals when it should be building primary care networks. A well-funded community health center prevents 10 hospital admissions. The return on investment is not even close. Shifting the architecture from tertiary care worship to primary care investment is the single most high-impact structural decision any African health ministry could make today. The community health worker lesson. Ethiopia's health extension program deployed tens of thousands of community health workers into rural communities and produced some of the most dramatic health outcome improvements seen on the continent. This model is replicable, it is affordable, it is effective, and most African nations are still not scaling it with the urgency it deserves. The data lesson. The world's healthiest countries make health decisions based on real-time, granular, community-level data. Many African nations are still making health policy decisions based on data that is years old, geographically incomplete, and clinically unreliable. Digital health infrastructure, mobile health data collection, telemedicine records, community health worker reporting systems, is the foundation of a modern health architecture. And it is buildable now, with existing technology. The lessons Brazil must urgently apply. Brazil is in a unique position in this conversation, because it has already built one of the most ambitious public health systems in the developing world, the SUS, and it is still falling dramatically short of the world's healthiest nation standards. The gap between what SUS promises and what it delivers is not a design failure. It is a political will failure. The world's healthiest nations fund their health systems consistently, across political cycles, across economic fluctuations, across changes of government. Brazil has allowed SUS to be politically weaponized, its funding expanded and contracted based on which party holds power, rather than treated as the non-negotiable national infrastructure it is. The second lesson Brazil must urgently apply is the racial equity lesson. Japan, Iceland and Norway do not have dramatic racial health disparities. Brazil does. Black Brazilians experience measurably worse health outcomes across almost every indicator, inside the same universal system. The world's healthiest nations have demonstrated that universal coverage without equity monitoring is not truly universal. Brazil must build racial health equity tracking, accountability and targeted intervention into the architecture of SUS. Not as an optional political statement, but as a clinical and moral imperative. What a global health architect takes from this. I did not become a global health and wealth architect to simply observe and analyze what the world's best health systems are doing. I became one to help design the systems that bring those standards to the communities that need them most. And what this comparative analysis teaches me, every time I study it, is that the gap between the world's healthiest nations and the communities I serve is not a gap of knowledge. We know what works. Universal primary care works. Prevention works. Community health workers work. Long-term investment works. Health equity policy works. The gap is a gap of political will, institutional commitment and the presence of enough trained leaders who can translate knowledge into architecture, into actual systems, actual policies, actual funding models and actual health outcomes for actual families. That is what Harvard prepares people to do. That is what this journey is building toward. That is what every video on this channel is a brick toward. A world where the answer to the question, what do the world's healthiest countries have that we do not, is no longer anything, because we built it. If this gave you a global framework for thinking about health systems, share it with one policymaker, health leader or young person in your life right now. Subscribe, comment below, which country do you think Africa should study most in its health system reform?